Dumelang Mzansi, welcome to the Health Club. I'm your host, Clement Manyatela. Today, we are diving into one of the most urgent issues affecting our families, workplaces, and communities: alcohol and drug abuse. Whether it's substance misuse at home, the rise of drugs like crystal meth, or the silent struggles of addiction, the impact is real and it's close to home. But this episode is not just about the problem, it's about the road to recovery and the role of our communities and the hope that change is possible. We've got expert guests, real life stories, and a powerful look at how South Africans are reclaiming their lives. So stay with us. The Health Club starts now.
At Ladgag, we are not only working with drug addicts, we also help community combating crime.
Addiction is a process whereby the relationship with the substance develops over time and becomes the primary relationship.
First, chase what's in your heart, chase your dreams. Alcohol should not be part of it.
Substance abuse doesn't always begin in dark corners. Sometimes it starts at home, at work, or in moments of pain we don't talk about. In today's episode, we go beyond the surface to understand what really fuels drug and alcohol abuse in South Africa, how recovery works, and what support systems are available. So let's start with a story that brings these issues to life. And when we come back, we'll be joined by guests in studio who will help us unpack this important conversation. Stay with us.
My name is Lakin Timane, the founder and convener of National Liquor Traders. So we see the need to almost balance and reduce the harm that is caused by irresponsible usage of alcohol, with also the need to almost sustain our businesses. So, and it is incumbent upon us as liquor traders that we put the safety of our patrons first, the safety of our communities first, ahead of the profits of our businesses. So the interventions are targeted at tavern owners to ensure that when they have a reasonable apprehension that anyone coming to the establishment is not of the right age, they should demand and ask for an identification. In the main, we want to believe that our liquor traders are compliant to those key conditions, but we also know that in any environment you'll have rotten apples, you'll have those that want to put the profits ahead of the lives and livelihoods of our people. So message that we give to the youth, I mean, as a father of four and having an older 20-year-old daughter and a 17-year-old son, the conversation is the same, because whatever message that I need to send out there is something that should start from my own home. Alcohol is not a means to entertainment, it's not a means to fun. Alcohol should only be consumed by those who can afford to buy alcohol with their own money. It is not something that should take precedence over your studies, over your career. First, chase what's in your heart, chase your dreams. Alcohol should not be part of your dreams. Alcohol should be a means of enjoyment as you celebrate your achievements that you have set out as you are growing up. But it's not something that should form or should be central to your ambitions as a youth. So even though we make money selling alcohol, but it's not something that I will encourage my kids to put ahead of any other plans or any other dreams that they have in their lives. The right time will come for them to consume alcohol, and when they do decide to drink alcohol, they should do so in a responsible way. Let's not bother our parents and our uncles with money to buy alcohol. If you can't afford it, it means you should not be drinking.
Welcome back. To help us unpack this critical issue, I'm joined by two guests who bring both expertise and compassion to the table. We're joined today by Thembekile Msane, who's the Head of Treatment and Training Coordinator at the South African National Council on Alcohol and Drug Dependence, and Dan Wolf, who's a specialist addiction psychologist and counselor, also director at the Houghton House Group of Addiction Treatment Centers. Thembekile and Dan, thank you so much for making time for us.
Thank you for having us.
I just want us to start with just an assessment in our communities of how bad the issue of addiction is. I mean, we've had so many awareness campaigns, but how bad is it, Thembekile?
It is quite severe at the current moment, especially in our rural areas where we see a lot of severe substance use disorders. And at the current moment, we are looking at about over 60%, of people actually with substance use disorders that we are currently treating. And there are those 40% that are not yet into the system or into treatment, especially when we're looking at, as I mentioned, rural areas as well as some of your townships where there is a limited access to treatment, and also for them to be able to be assisted as soon as possible.
Then what are the driving forces? I mean, if it's with all the awareness that we've had, and this is still a big crisis in communities, from your observation, your work, what is the driving force behind the addiction?
I think fundamentally we live in a culture that normalizes substance use. And it's very common for young people to start using substances without giving it much thought. But then psychologically, we know that the transition from adolescence into adult life is very challenging. And when people are faced with emotional turmoil and feelings of uncertainty, they then start developing a relationship with the substance, whether it be cannabis, whether it be alcohol. And when a crisis hits, it's not uncommon for the individual then to turn to what they've now identified as a available support system, which unfortunately in many instances is a substance.
Yeah.
And the relationship with the substance develops over time. And I think that that's really what needs to be understood. Addiction is a process whereby the relationship with the substance develops over time and becomes the primary relationship in the person's life.
Yeah.
And that unfortunately results in chaotic behavior, unmanageability, and people betray their families, they betray themselves, and their development is compromised in a very significant way.
Yeah, and Tembekile, I want us to stay with just the issue of normalizing it in our communities, because in our small little corners, it's almost like we can't have fun without the drink. So
True.
You can't be a cool friend if you're not going to smoke. So how do we then deal with it on the ground? Because the pressure comes from family members. You're sitting with your cousins after a funeral, at a party. It's almost like it's an expected thing as a young person that you must have a drink or smoke to look cool. Where do we start driving that change in behavior?
Alcohol is one of the key things that people utilize to celebrate, whether it's a wedding, whether it's a celebration of a birthday or enjoyment for that matter. So all those things, what we are saying is we need to go back to family values. We are realizing that a lot of families, they are actually dysfunctional, they are toxic, and we need to be able to address those kind of issues, because we are not only seeing children who have substance use disorders, but rather parents who are also struggling or have a long-term predisposition kind or genetic kind of problems when it comes to substance use disorders. So we need to be able to say, how do we actually come up with interventions? Hence, we are talking evidence-based practice. So we need to be able to, currently we're doing research to be able to say, what is the prevalence studies, especially in our rural areas, KZN, Northern Cape, Eastern Cape, Limpopo. That's where we currently are at, to be able to say, let's do a situational analysis as well. Let's do door-to-door campaigns and be able to work together as governmental departments as well as NPO sector together with corporates to say how would be the next generation actually be perceived as, because we need to be able to say who are our prevention influencers. We've got influencers, but can we have prevention influencers to say it is cool to have fun without alcohol. It is cool for me to not belong in a crew, to belong in a group in order for me to belong.
And it's cool for you to also, when you realize that you've been drinking and you have a problem, to also seek help, which is where you would come in then, where people now come and they somehow want to start a recovery journey. What does that look like?
Generally, the objective party who identifies the problem is not the patient.
Yeah.
So there's pressure coming from somewhere, and the myth needs to be dispelled that the person has to want the help. Because when there's pressure coming from the family, that allows or facilitates a way forward. So people arrive at the facility and we start an assessment process. And what the objective then is for us to work with the individual so that they betray their addiction and they reconnect with the family. They need to, as you say, have to acknowledge who they really are, because you speak about being cool, but what we need to start putting out there is being cool is being real. And when the person starts being real and exposing who they really are, they make meaningful connections with their family members, they make meaningful connections with other people, and therefore become less dependent on a substance to facilitate interpersonal contact.
Yeah, and of course another challenge is also just the stigma around addiction. So some people want to get help, Tembekile, but you know, in our communities, as soon as you say, I went to a treatment facility, I went to a facility that deals with addiction, already you're seen as, so it's not seen as, you're getting help. What a good move. Like, people look at you with shame. There's still stigma around that.
Yes, they still judge you. And I think that's why stigma is still a big thing. Hence, what Dan was actually saying here is that we also get to educate families. And hence, those some of the prevention and awareness campaigns in a multi-sectoral, stakeholder engagement, we get to be able to educate communities on how, for the social integration, how to receive a person back from treatment. Because treatment is the first phase, like he's mentioning. But when we start recovery, remember, you're going back home. You're going back to the same people that will look at you differently. If something is missing in the house, you are the first person they will actually look into, so those are some of the things that we also educate most of, our patients in treatment on how to be able to handle those kind of stigma, those kind of discrimination that they will actually perceive outside, because it is part of their recovery. So we focus a lot on positive psychology, where we're building more resilience, not just only looking into, what has been happening that is only wrong, but to his point, to be able to say the good in me, the ability in me, that self, intuition that I began to realize about who I am. Because sometimes people lose who they really are through addiction. Like he was saying, people build that relationship with addiction. So what really needs to happen in recovery is that people need to go through a support system as well. We've got, like your rooms, your NAA meetings that people also get involved into. Your psychotherapy, it needs to be something that remains consistently also as well. Remember, addiction is more 80% psychological and 20% physical. So we need to make sure that the way you see yourself, the way you think of yourself, the way you are able to conduct yourself, we are able to change that negative, that bad habit into something positive. So hence we are able to build resilience, in your recovery, to say you need to do it for yourself. Don't do it because at work you got suspended, because you got caught, or you are absconding at work, or at school you actually got expelled. No, you got to do it for yourself. Don't do it for your parents. And hence that first step. Hence we are able to also do assessment when it comes to the different stages of change. We look at the different stages of where the person is while in treatment, even post-treatment, when they start their recovery. We need to be able to know where actually are they at in terms of the stages of change.
And it's okay to, when you have fallen off your recovery journey, to come back on, right? And I suppose that's another shame, then, that some people are brave enough to start that journey, and then something happened, they relapse, and they think, should I go back? It's my second time, it's my third time.
Well, on day one, Clement, what needs to be the focus is what we speak about at Houghton House. We talk about a continuing care model. So it needs to be understood that if you leave here after a 30-day primary care program and we never see you again, the chances are you are not doing well. Because the whole process of recovery, which we're speaking to this evening, is about adopting a different way of being. Just like we spoke earlier about a culture that normalizes alcohol use or substance use, there's also a culture of recovery. And we want to integrate people into a culture of recovery. And part of that process is about acknowledging that there will be times of vulnerability, and should I need the support, whether it's readmission, whether it's a phone call, whether it's reassurance about how to handle an emotionally challenging situation. People in recovery have to appreciate that the highest value is their reclaimed honesty and integrity. And when that is emphasized, it becomes a far more workable scenario, and people are then able to engage successfully in a continuing care process.
Yeah. Tembekile, someone is probably watching us now and saying, yeah, I hear you guys, but it's easier said than done. I'm sitting here, I'm unemployed. All I see are my friends in my community who wake up and they go to drink. I've got nothing to do. I don't have psychologists or social workers to talk to. So this is my way of just numbing that pain. What do you say to them?
Firstly, there is, a 24/7, a call, helpline that the substance use has, with the Department of Social Development, with SADC, that people can actually just contact, just like he said, just a conversation, to your point. I'm not feeling great and this is where I'm struggling. I don't have money. So get to find out where you can be able to get help. And yes, at times we do realize that people don't even have data, to be able to go into the social media to find help, So that's why we say that call is a free toll-free number that people can be able to have accessible to. There is also, Chomi, where you just send a WhatsApp and people are able to respond back, call you and follow up with you. And I think that's something that is quite missing at the moment. And look at locally, where you are at, for any Department of Health, Social Development, or any SADC, as I said, SANCA office around you, there's Houghton House as well. We need to be able to say there are private and subsidized, facilities that can be able to assist someone. At churches, are a big thing in rural and townships. Go there. We are really working together, with the religious sector, together with the traditional leaders. We are now gravitating to the traditional leaders. So go to the tribal house if you are in those rural areas to say, I've got a problem with substances, and this is where I really need.
And speaking of help, then we often speak about the importance of the support system for the addicts or recovering addicts. But who supports the supporters of the drug addicts? Because there are families out there who have supported their loved ones and they felt betrayed and they're at their wits' end. They're thinking, should I even still have hope here?
The family is very often the most workable part of the equation. And unfortunately, there are many treatment centers that neglect the obligation and the imperative to create an adequate family support program. And that's why at Houghton House we've actually gone to great efforts to ensure that we have recovery assistance that actively involve the family members, because at the end of the day, the family is deeply affected and the patient is the family. And what I've seen time and time again, the prognosis of the patient, the likelihood of the patient being successful is directly proportionate to the extent of family involvement. So despite the fact that family members at times feel so despondent, they need to understand that the impact of their true and deep heartfelt feelings are received somewhere but may not be immediately recognized.
Yeah, you can just hear just how deep the need runs for spaces where young people are truly seen and supported. It's not just about healing, it's about being heard, it's about being understood. We want to bring that even closer to home now. Phili Muloto has been working tirelessly with the youth in vulnerable communities, offering not just a shoulder to lean on, but tools to stand up. Let's hear what he had to say.
I'm Phili Muloto, born and raised Seshego Polokwane, and I'm a founder of the organization LADGAG, Limpopo Anti-Drugs, Gangsterism and Crime. I started because I care about the youth of South Africa. At LADGAG, we are not only working with drug addicts, we also help community combating crime. Drugs are causing many diseases, are causing bipolar, abscess, they are causing depression, but parents are also in the very serious crisis because they are also depressed. It's not about those who are smoking drugs, it's about the community. Neighbors are crying because of the drug usage, because they are stealing from the community. Parents are paying debts that they didn't even know about. When you do our programs like 12-step programs, they talk to you as an individual. They make you realize what you did wrong, what are you planning to do in the future. Lack of sponsor is another problem. Stakeholders must come in. People like SETA must come in, because most of these young ones, they are leaving school at the grade 8, and now he's 27, you won't go back to those grades. So that's why we are busy planning to build a center that has got skills development training. We need support from government to assist us in this pandemic.
It's clear that people like Philly aren't just holding space, they are changing lives. And it's this kind of dedication that reminds us how vital it is to create structures of care that actually work for our youth. Don't go anywhere. The Health Club returns after this. Welcome back. There are a few things we've learned from this episode. Alcohol misuse is often rooted in trauma and escape. It starts young. Binge drinking culture is normalized and dangerous. The effects aren't just physical. There's still a stigma around asking for help. Peer support and mentorship are powerful. Families and schools must be involved. GEMS is stepping in. With dedicated wellness programs, GEMS is helping both members and families access early support, counseling, and recovery tools. As we've seen today, tackling substance abuse requires a collective effort from families, communities, and institutions alike. At GEMS, the commitment to member wellness goes beyond just covering medical bills. They're actively investing in programs and partnerships that support healthier lifestyles and long-term recovery. Let's take a moment now to catch up on some of the latest developments and initiatives from GEMS that are making a real difference in the lives of South Africans.
Welcome to GEMS News. In this edition, we discuss substance abuse and the journey toward recovery. Alcohol and drug abuse can severely affect your physical and mental health, relationships, and financial stability. Acknowledging the problem is the first crucial step to recovery. GEMS offers support through access to mental health benefits. Recovery is possible. If you or someone you know needs support, don't hesitate to reach out through our member servicing channels. You're never alone on the road to recovery. For more information, visit the GEMS website or contact us through our social media channels.
From the stories we've heard to the insights shared in studio, one thing is clear. Alcohol abuse affects more than just the individual. It touches families, communities, and the very fabric of our society. But there's hope. With support, education, and the right interventions, recovery is possible. Whether it's through programs like those offered by GEMS or simply by having an honest conversation, every step counts. Ngiyabonga, Realebocha. Thank you for joining us on the Health Club. Stay safe, stay informed, and remember, your health is your power. Until next time, take care of yourself and each other. Cheers.